It's time for another episode of Pottawattamie County Roots, presented by Hoy Kilnoski Funeral Home. Hi, I'm Todd Studer. So, NAMI Southwest Iowa has its fourth annual Hope Illuminated Gala. It's coming up on Saturday, November 7th, and it will be at the Mid-America Center. Yeah, it's still several months away. However, I want to tell you about it. Social hour begins at 5, gala runs until 10. They're planning a dinner. There'll be auctions, a dessert dash, stories of hope and recovery. Kody Green will be there as the speaker. I want to spend some time talking about the gala, but I also want to talk about the organization behind it. NAMI Southwest Iowa is doing work across 9 counties. And unless you have attended one of its programs, supported somebody who has, or gone looking for mental health information yourself, you may not even know everything that is available. NAMI stands for the National Alliance on Mental Illness. The local affiliate serves these counties: Cass, Fremont, Harrison, Mills, Monona, Montgomery, Page, Pottawattamie, and Shelby counties. Here in Pottawattamie County, that means the organization serves people from one end of the county to the other, including cities, smaller towns, and rural areas. The full-service area also reaches communities like Atlantic, Clarinda, Glenwood, Harlan, Missouri Valley, Red Oak, and Shenandoah. That is a very large area for any local nonprofit to cover, and even inside of Pottawattamie County, access can look a little different depending on where somebody lives. There's work schedules, there's transportation, family responsibilities, also privacy and distance, all affecting whether a person is able to take part. Online programs can help with some of that, but not everybody has the same internet access or the same comfort level with meeting online. NAMI Southwest Iowa began with local mental health professionals, family members, and people living with mental illness who wanted to establish an affiliate in this part of the state. A steering committee was officially formed back in October of 2017. The organization received its nonprofit designation in January of 2018, and during that year, it began recruiting members and volunteers, training program leaders, and offering services. It also held its first annual meeting and hired a part-time executive director. So this is still a relatively young organization. It doesn't have a 50-year history in Southwest Iowa, but it has developed a collection of support groups, education programs, and presentations for people living with mental health conditions and the families supporting them. The mission is to create a community free from stigma by increasing awareness about mental illness and providing support and education to individuals and families affected by it. I think the education part is very important because most people do not spend time learning about a mental health condition until it becomes personal. Then, suddenly, a person or a family is trying to understand new terms, treatment options, warning signs, schools, insurance, providers, what to do if the situation becomes a crisis. There's also the question of how to talk about it. A parent may not know how to begin a conversation with a child. Maybe you have a spouse that's been trying to help without making the situation worse. The person experiencing symptoms may be concerned that friends, relatives, or an employer will see them differently once the subject even comes up. Those are not simple conversations. People are not automatically prepared to have them. NAMI is not a replacement for a doctor, a therapist, medication, professional treatment, or emergency help. Its role is different. It provides peer support and education and gives people a place to learn from others who have experience with some of the same questions. The support groups and education programs we're talking about are offered free to participants. Now, free to participants does not mean there's no cost to operate the programs. Leaders have to be trained, meetings have to be scheduled, materials and technology have to be maintained. Somebody has to communicate with participants and answer questions. An organization serving 9 counties also has to make sure people throughout the entire area know the programs are available to them. The money raised through Hope Illuminated Gala helps support NAMI Southwest Iowa and the programs and services it provides across the region. One of the programs offered by NAMI is NAMI Connection. This is a peer-led support group for adults living with mental health conditions. The leaders are trained, but they also bring lived experience to the group. That matters because there is a difference between understanding a condition from a textbook and understanding what it's like to manage one in your own life. The group gives people an opportunity to talk with others who understand at least part of the experience. Participants can discuss what has helped them, what has been difficult, and what they're still trying to work through. Nobody has to pretend that recovery follows one path or happens according to one schedule. A strategy that works for one person may not work for another, but hearing how other people have handled a similar problem can still be useful. Looking for a career where the work you put in will determine what you earn? Jackie Dirks with Globe Life Family Heritage in Council Bluffs is growing her local team and looking for a motivated, independent sales agent. The opportunity includes training, performance-based income, renewal commissions, and leadership potential, while helping working families protect what matters most. No insurance background is required. Bring a willingness to learn and work. Contact Jackie Dirks at 402-676-3602 today to learn more. When a family experiences loss, every detail matters. Hoy Kilnosky Funeral Home and Crematory provides compassionate guidance and personalized services designed to honor each life in a meaningful way. From traditional funerals and cremation services to pre-planning and grief resources, their experienced team is there to help lighten the burden. Hoy Kilnosky Funeral Home and Crematory in Council Bluffs. Learn more at hoyfuneral.com. NAMI Southwest Iowa also offers the NAMI Family Support Group. This is for adults who have a loved one experiencing symptoms of a mental health condition. Family members can easily become so focused on helping the person who's struggling that they don't pay attention to what the situation is doing to them. A parent may be looking for a provider, working with a school, handling appointments, watching for changes in behavior, and trying to keep up with everything else happening in the family. A spouse, sibling, or adult child may be trying to decide when to help, when to step back, and how to set a reasonable boundary. Those family members need information and support too. The NAMI Family Support Group follows a structured model. The groups are confidential, led by family members of people living with mental health conditions, and available without requiring NAMI membership. They don't promote one specific medical treatment. The purpose is to give family members a respectful place to share experiences, also to improve coping skills, learn from one another, and deal with some of the guilt that can become part of caregiving. I think there is a tendency for caregivers to believe they're supposed to know what to do all the time. That's not realistic. Supporting yourself does not mean you care less about the person who's struggling. It means you understand that you also need information, rest, boundaries, and a place to talk honestly. So moving on to the education side, NAMI Peer-to-Peer is an 8-session program for adults living with mental health conditions. It's taught and trained leaders with lived experience and includes discussions, activities, and educational material. The goal is to help participants learn more about mental health and develop strategies they can use in their own recovery. NAMI Family to Family is another 8-session program. This one is for family members, significant others, and friends of people living with mental health conditions. It covers communication, coping, problem solving, and information about mental health. The instructors are NAMI-trained family members, so once again, the program combines a structure with personal experience. Professional care matters, and people should work with qualified professionals when treatment is needed. At the same time, there's value in hearing from somebody who has already made the phone calls, sat through the appointments, worked through a crisis, and learned which questions were useful. That person is not taking the place of a doctor or therapist. They're offering another kind of support. NAMI Basics is designed for parents, caregivers, and family members supporting a young person age 22 or younger who is experiencing mental health symptoms. The program covers treatment, schools, advocacy, crisis preparation, the juvenile justice system, and the effect a mental health condition can have on the entire family. So if you're a parent dealing with this for the first time, there can be an enormous amount of information coming at you. You're trying to help your child while also learning about providers, school policies, warning signs, treatment, and what to do if the situation gets worse. NAMI Basics is intended to help families organize that information and connect with other people who understand why it can feel overwhelming. The organization also offers presentations for schools and community groups. Ending the Silence is designed for middle school and high school students, school staff, and parents. It focuses on recognizing signs and symptoms and understanding why it is important to respond when somebody may be struggling. In Our Own Voice gives people living with mental health conditions an opportunity to share their experiences with the public. Family and Friends provides information about supporting a loved one. NAMI Southwest Iowa also lists programs intended for Latino communities, African American communities, faith communities, healthcare providers, veterans, and other groups. Not every one of these programs is going to be scheduled at every community at the same time. If you hear something that sounds useful for your family, your school, church, workplace, or community group, contact NAMI Southwest Iowa. Ask what's currently available. The website also has a program interest form, which gives the organization a better idea of where people are looking for a particular class or presentation. NAMI Southwest Iowa also has Reconnect programming for people with lived experience and for caregivers. The point of having several programs is that people do not all arrive with the same needs. The person living with a condition has one perspective, a family member has another. Teachers, employers, healthcare providers, and friends may all be trying to understand how they can respond appropriately. No one program is going to answer every question, and NAMI Southwest Iowa is not going to solve every problem in the mental health system. It can't create enough providers, eliminate every transportation problem, or fix every issue involving insurance. What it can do is provide support groups, offer education, answer questions, and help people find a useful place to begin. That work now brings us back to the gala. Again, it is on Saturday, November 7th at the Mid-America Center. Social hour begins at 5. The program runs from 6 to 10. There will be dinner, auctions, a dessert dash, and stories of hope and recovery. I've never been involved in a dessert dash where people did not become more competitive than they expected. Everybody's friendly until two tables decide they want the same dessert. Then it gets interesting. That is part of the fun of the evening, and there's nothing wrong with having some fun while supporting a serious purpose. The gala gives NAMI Southwest Iowa an opportunity to raise money, tell people about its programs, and bring mental health into a public conversation. Too often, the subject only comes up after something has gone wrong. A person waits until symptoms become more difficult to manage. A family is already in the middle of a crisis. An employer realizes there's a problem but no idea how to handle the conversation. An event like this is a chance to talk about mental health before that point. It's also a chance for people to learn what is already available throughout Pottawattamie County and the rest of the 9-county area. Somebody may hear about a support group for the first time. A school may learn about a presentation. An employer may find a resource that would be useful for employees. A family may realize that NAMI Southwest Iowa serves the community where they live. And then there's Kody Green. Kody is an author, motivational speaker, content creator, and mental health advocate. He's publicly shared that he was diagnosed with schizophrenia at age 21 after dealing with psychosis and addiction. His experience with serious mental illness began before his own diagnosis because, as a teenager, he helped care for his mother, who lived with a schizoaffective disorder. That gives him a perspective as both a family caregiver and a person managing his own mental health condition. Kody has also talked openly about struggling in college, addiction, incarceration, and the work of rebuilding his life afterward. His story is not a simple one where everything was bad. He got treatment, and then every problem disappeared. Recovery takes work. In Kody's public conversations, he talks about medication, sobriety, support, employment, family setbacks, and the decisions he continues to make while managing his health. Kody says he is trained as a peer support specialist, recovery coach, and suicide prevention specialist. He also began sharing his experiences online, where many people know him as Schizophrenic Hippie. His website says he has more than 2 million followers across social media. And that number is impressive, but the subject of the content is more important. Kody talks about what schizophrenia looks like in his life. He discusses symptoms, medication, work, parenting, daily routines, recovery, and the assumptions people make when they hear his diagnosis. So he uses humor and tells personal stories, which gives people a chance to see more than a list of symptoms. A lot of what people think they know about schizophrenia comes from movies or televisions, jokes or crime coverage. That does not provide a very complete picture. Kody can't represent every person living with schizophrenia, but he doesn't need to. He can explain his own experience and give an audience something real to consider. Kody's also the author of Minds Over Meetings, a personal perspective on wellness in the workplace. The book was published in 2025 and looks at mental health from the employee and employer side of the workplace. It includes strategies for employees managing their well-being and employers trying to create a more supportive environment. What if your healthcare provider came to you? Me to You is an Iowa-based in-home primary care practice, bringing personalized medical care directly to your home. Especially helpful for people who have difficulty getting out, Me to You serves patients of all ages, from children through end-of-life care, from wellness visits and chronic disease management to preventative care and advanced care planning. That means less time traveling, less time in waiting rooms, and more time where it matters most. Learn more at metoyou.care or call 641-843-8405. Cancer care, behavioral health, patient transportation, scholarships. These are some of the programs supported by Jenny Edmondson Foundation. Donations help Methodist Jenny Edmondson Hospital serve patients and families throughout Southwest Iowa, including free Medivan transportation for patients who can't drive or use public transportation. Learn more about the foundation and ways to give at jehfoundation.org. That's jehfoundation.org. Turn your business vision into a digital presence that gets noticed with Just Sue Creative. Founder Sue Pitts brings more than 20 years of small business development experience to every project, combining strategy with custom website design, SEO, branding, content creation, and marketing. Whether you need to build your online foundation, reach more customers, or just sharpen your message, Sue creates a budget-friendly plan tailored to your goals. Schedule your free consultation today at justsuecreative.com. That is relevant to businesses here because employees do not leave the rest of their lives in the parking lot when they come to work. People may be managing anxiety or depression or trauma or addiction recovery or many other mental health issues. An employer is not a therapist and shouldn't be trying to diagnose employees, when employers can learn how to have appropriate conversations, understand the resources available, and get qualified guidance when questions involving leave or accommodations come up. They can also avoid assuming that somebody who asks for help is no longer capable of doing the job. Kody also speaks publicly about second chances. He's dealt with addiction, incarceration, and the difficulty of rebuilding. Accountability matters, and nothing about treatment or recovery erases the past. But a person who has completed a sentence and is trying to rebuild a stable life still needs a realistic way to move forward. Employment, housing, treatment, and support, all part of that. If every job and every housing opportunity is closed, stability becomes more difficult. It doesn't mean every person is entitled to every job or apartment. It just means communities have to decide whether second chances are something we actually believe in, or simply something we like to say. So Kody can speak to the overlap among mental illness, addiction, incarceration, employment, family, and recovery because he's lived through it. That is what makes him a very good fit for this event. The gala is about hope and recovery, but that is not about pretending those things are easy. People are going to be attending for different reasons. Some have personal experience with a mental health condition, others supporting a family member. There will also be people from healthcare, education, law enforcement, corrections, human resources, social services, business, and churches. Somebody else may attend simply because they want to understand the subject better than they do now. Social Hour is also going to give people an opportunity to meet the individuals involved with NAMI Southwest Iowa. I talk all the time on this show about the importance of relationships throughout Pottawattamie County, and people learn about resources because somebody makes an introduction, passes along a phone number, or tells a friend about a program. A conversation at the gala could lead to a school presentation, maybe a workplace resource, a sponsorship, or a family learning where to turn for support. Attending one gala will not solve every mental health issue in Pottawattamie County or Southwest Iowa. It will raise money that helps support NAMI Southwest Iowa and its programs, and it will give the organization more visibility and allow people to hear stories of hope and recovery. It's also going to bring Kody Green in front of people from across the region who maybe haven't heard his story before. And yes, it should also be an enjoyable evening. That's why there's dinner and the auctions and the dessert dash and time to visit with people. A fundraiser doesn't have to feel like work every minute of the night. So enjoy yourself and understand why the event matters. The name Hope Illuminated fits the purpose. Hope does not mean ignoring symptoms, addiction, family strain, legal consequences, or the amount of work recovery can require. It does mean understanding that there can still be another step. That could involve treatment, or a support group, or a class for a family member. Maybe just an honest conversation, or a second chance for somebody that has done the work to move forward. So please, put Saturday, November 7th on your calendar. It's the 4th annual NAMI Southwest Iowa Hope Illuminated Gala. It'll be at the Mid-America Center, one arena away in Council Bluffs. Social hour at 5. Program runs from 6 to 10. So for the latest ticket and sponsorship information, please go to NAMISouthwestIowa.org. That's also where you can learn more about the support groups and the education programs, the presentations, and other resources offered through NAMI Southwest Iowa. You can also give the organization a call, 712-542-7904. That is their information line. It's not a crisis line. If you or somebody you know is experiencing a mental health or suicide crisis, call or text 988, please. Online chat also available through the 988 Suicide and Crisis Lifeline. If somebody is in immediate danger, please call 911. I would encourage you to take a look at the gala information. Learn more about NAMI Southwest Iowa. If you know somebody who may be interested, share this episode, please. Send them the event information. That could be a family member, a teacher, an employer, a pastor, or maybe just somebody who wants to support the organization. And yes, it is close to my heart. Full disclosure, I'm vice president of the board for NAMI Southwest Iowa. And please, I'm looking forward to seeing you there. And if you'd like more information about sponsorships available, I'd be happy to have that conversation with you as well. Thanks for watching this episode of Pottawattamie County Roots presented by Hoy Kilnowski Funeral Home. If you click like, share, follow, subscribe, one or all of them, it helps the algorithm push this information out further so more people can learn about the businesses, events, and people that we talk about right here on the show. It's free for you to do, and it's a way that you can help support local media. My name is Todd Studer. We'll see you next time.